Hi, everyone. Thank you for joining us for today's webinar, Neuroscience, Yoga Meditation, and Mental Health, Fostering Pandemic Resilience and Recovery. We will be starting in about 2 minutes. Thank you for your patience.
Namaste and good afternoon. Welcome to our webinar titled Neuroscience, Yoga Meditation, and Mental Health. I'm Dr. Aparna Ramaswamy, the Vice President of Dharma into Action, DIA Foundation. Thank you for joining us this afternoon. Dharma into Foundation, DIA, is a nonprofit organization founded in 2020 by Dharmic American leaders and philanthropists interested in the preservation and celebration of the philosophy, culture, and traditions of South Asia and East Asia. DIA aims to identify and respond to urgent needs in the community with evidence-based practices that embody a secular and inclusive core values and approach. DIA has focused in the last year on several initiatives, most especially meditation and mindfulness for stress relief for frontline workers dealing with COVID, healthcare workers, law enforcement officers, other communities in need. It has worked with college students in mindfulness in action. How do you take that mindful disposition and put it to work? And that brings us to today's event. But before I begin that, some of our recent events that the year has focused on has been one on life paths and choices for women of Dharma, which was our inaugural event on April 24th, 2021. We had most recently a fact check addressing disinformation about COVID-19 and India, where we had the United States Surgeon General, Dr. Vivek Murthy, walk us through not just what is the situation now, but what can we anticipate as we move forward. And that brings us to today's event, Neuroscience, Yoga Meditation, and Mental Health in the COVID climate. How do we foster pandemic resilience and recovery? And we have a panel of great experts, mental health providers, neuroscientists, and community workers, social workers who are in the field to guide us on what is happening there right now and what more we can do. Now, this particular conference is not going to focus on the historical wealth of yoga. Beyond just meditation, yoga as a practices, whether it is selfless service of karma yoga, whether it's knowledge-based service of jnana yoga, of dhyana yoga, meditation, which is kind of what we're focusing on, or bhakti yoga. We have several texts that inform the field of yoga. I want to acknowledge that, but we're not going to go into any of that for this particular conference. We will be focusing primarily on yoga is meditation. Most of us are familiar with Ashtanga Yoga, Patanjali's Yoga Sutra. And while there is a lot of research, scientific and neuroscientific research on the various limbs of yoga, You can find out what does a particular asana do to a person's well-being. You can talk about pranayama and its effects on the relaxation response that you'll hear Dr. Parker talk about in a little bit. So, this particular conference is only going to focus on one sliver of what yoga is to commemorate today, the International Day of Yoga. So, yoga popularly is perceived practice, as a physical practice of asanas and pranayamas, and oftentimes its destination of meditation is less practiced. So, this particular conference today is focusing on the neuroscientific benefits of yoga meditation and its relevance to mental health. So I'd like to invite our very first speaker, Dr. Stephen Parker, to start off our conversation. Dr. Parker, his spiritual initiate name is Thoma, was initiated in the Himalayan yoga tradition by Swami Vedabharati in 1971. He is one of the earliest an experienced registered yoga teacher at the 500-hour level. He also serves in the board of directors in the Council for Yoga Accreditation International. He is a prolific author, a speaker, and above all, an absolutely wonderful human being, as evidenced by his clients in clinical psychology, which is his profession. So, Dr. Parker, if I might have you set the stage for us, and how exactly do neuroscience, yoga, meditation, and mental health intersect?
Thank you, Aparnaji. A few years ago, I realized as I was approaching my retirement from my clinical practice of psychotherapy that I had not really read a great deal into neuroscience for quite a few years, and I knew that the discipline was somewhat different. And so I got hold of some books by the neuropsychiatric researcher Daniel Siegel from UCLA, and I was absolutely amazed at the change that I saw from the neuroscience in which I was trained 30 years before. It was a whole different story in so many different respects. And what struck me about that is the way that neuroscience and yoga and meditation are moving now in parallel. And the sort of argument that has gone back and forth between yoga as a spiritual path and neuroscience as a scientific path of investigation has become much more collaborative in the last 30 years, due in large part to the work of Francisco Varela in putting together the Mind and Life Initiative, the initiative that brought the Dalai Lama together with neuroscientists to talk about some of these issues. And so the field of research in neuroscience and meditation has opened up incredibly. My own particular interest is in the technique of yoga nidra that the yogis have, of conscious delta wave sleep, which I'm working on trying to refine the research methodology for. But there are so many areas, and I think it's particularly fitting that on this International Day of Yoga, we focus on what is the key skill in all of yoga across the board, which is mindful awareness. That mindful awareness is what makes every practice in yoga work, whether we're talking about asanas or pranayama or meditation. Without mindfulness, there is no yoga. There's no such thing as yoga. And that awareness really is what all of the great teachers of all of the great spiritual traditions has been trying to teach people. Buddha wanted people to be enlightened. Jesus said to his disciples, the kingdom is all around you, you don't see it. He wanted people to see, to really experience mindfully what was going on in their life. And that aspect of mindfulness, when we apply it to mental health issues, has become such an important resource that, we jokingly say these days that mindfulness is sort of taking over the whole field of mental health. So many of the modalities of therapy, whether we're talking about trauma, therapies for mood disorders, many other aspects of therapeutic work have taken on mindfulness as a fundamental skill in making things work, to the extent where, for example, cognitive therapy, which used to be a matter of helping people identify the cognitive part of their emotional life and working on shifting those beliefs as a way of redirecting the emotional energy, Turns out you don't even have to do that. The British School of Mindfulness-Oriented Cognitive Therapy has realized that really all you have to do is teach people to observe the flow of their thoughts and feelings and their awareness from moment to moment, and those beliefs shift almost by themselves. And that's the quality of mindfulness and what it can do for you. If all you did in your life by way of yoga was simply to become more mindfully aware, your whole life would change. Your life would be completely different. And as you cultivate the habit of moment-to-moment mindfulness in your life, starting from simply being aware of the sensation of breath moving in your nostrils, if that's all you did, then there is no moment in your life when you are not practicing yoga. You stand at the bus stop mindfully, feeling your body from inside, which very few people do. Holding your body in a relaxed posture so you don't get stressed out when the bus is late or the train is late. So this is an enormously important thing. And it also is an aspect of our, the functioning of our physical being that is so important. The cultivation of mindful awareness helps to support our immune function to an enormous degree. It helps with all the processes of healing in the body. It would be fun to go into detail about that, but we just don't have time to do it at the moment. But these are some of the most powerful things you can do actually to support your physical resilience to COVID, your resilience to the mental health problems that can spring up in response to the illness. It changes your whole relationship to everything in your life. And if you happen to be ill, it changes the relationship to the illness and can help to move that in a more healing direction. So all of these things fit together in a really beautiful way. And I just find it such a privilege to be around at a time when things are moving in such a collaborative way. And I think that's probably enough of an introduction for the moment. So thank you, Aparna.
Thank you so much. And I think as we get further into the discussion, you'll likely hear Stoma talk more about the relaxation response and what exactly happens in our brain as we just focus on our breath. More to come. We move on to our second speaker, which I would love to introduce to you, Dr. Manoj Jain. Dr. Jain is an infectious disease physician, a writer, a national leader in the healthcare quality movement. More relevant in recent times, he has even been dubbed the Dr. Fauci of the South. He has been very actively involved in helping physicians, helping governments deal with the COVID crisis, not just in the United States, but also in India. So it is with extreme pleasure I'd like to invite Dr. Jain to the table. And Manoj, if you will, I know you and I have spoken a lot about this is not the time to talk about do we go yoga, do we do Ayurveda, do we do Western medicine, but it's the time for healthcare, grabbing everything and integrating it. If you might please speak to that need now.
Sure, absolutely. Namaste, everyone. And I'm delighted to be here. Aparna, thank you so much for putting all of this together. 6 years ago, I was at the Hubert Humphrey Building in Washington. That's the HHS, the Health and Human Services Office. And I was there in a conference room with Tim Ryan, Congressman Tim Ryan, who's written a book on mindfulness, John Kabat-Zinn, who has done tremendous amount of work on mindfulness, as well as Maya Sotero-Ning, President Obama's stepsister. And we were meeting with Vivek Murthy, the Surgeon General then, and again, the Surgeon General now. And this was first in a series of conversations we've had. And the fundamental question that we were asking was, how do we bring mindfulness and meditation to the mainstream in America? Just take a minute and think about that. Some may say it's already there. Some may say, but wait a second, why do we need to even do this? But think about jogging for a minute. Do you know that 100 years ago, if you saw someone running down the street, you might be thinking they're running away from something or running towards something? Now jogging is well accepted and it's part of our life. Meditation and mindfulness will soon be there, but how can we accelerate that? How can we bring it to a level where it is being practiced in schools all the time? So with Surgeon General, with Dr. Murthy, we discussed these things in great detail. And how do we see all of this is the following model that we began to create. And the model goes like this. Think about a tree. Imagine a tree with a big fat trunk. That's the wellness trunk. So you have a tree, you have wellness trunk, and then there are two parts to that. One part is physical well-being. So that's pretty simple. Physical well-being, you know about diet, exercise, sleep, tobacco-free, violence-free, drug-free. That's the physical wellness. But then there's the other trunk that we are ignoring in large part. That's emotional well-being. And Dr. Murthy was very clear. That's where we needed to really focus. So what does emotional well-being mean in our in our life today? Well, yes, it also has exercise, sleep, but then it has three core elements which we are missing and which in fact COVID is saying we need in this time of COVID. Those three elements, number one, connectedness, critically important. Connectedness, and we have seen what the COVID pandemic has done for us and in separating us. As an infectious disease doctor, I know better than anyone else when I have seen patients die in the ICU, not with their families, and just watching them on a Zoom call. It's very painful. Second is resilience. Resilience is paramount to us. We will go through difficulties in each stage of our life. And in our lives, we need to find ways of getting back. The dharmic traditions have incredible amount of value in giving us a pathways of how to build resilience. In fact, the Jaina Convention, which is being held this July virtually, the theme is resilience. And lastly, as most importantly, as Dr. Parker had talked about, how do we build this emotional well-being in this tree? It's mindfulness, that awareness of moment to moment, awareness that yes, we live in a very difficult times, but it will pass and we will find a way. That awareness is what is important. Imagine if we were able to take our entire population and help train them in mindfulness meditation practices, we would help reduce the burden of disease and illness. As an infectious disease doctor, I know the physical burden that COVID has caused, the thousands of lives that it has cost us in so many ways. There is an emotional burden that comes after and during that physical burden. And that emotional burden, 1 in 3 people suffer from some type of a neurological, psychological, or psychiatric problem. May it be PTSD, may it be anxiety, may it be depression. The many traditions that we are talking about, the dharmic traditions, they provide solutions to help us with that. So this is the best time for us to be sharing the dharmic traditions and the practices of yoga and meditation with a broader group. So I open that conversation again back to you, Aparna, and thank you so much.
Thank you, Manoj. And I know we are just kind of building the threads as we move forward to have a larger group discussion. So I'd like to next invite Dr. Helen Lavretsky to join the conversation. Dr. Lavretsky is a academic psychiatrist with a large research portfolio that is dedicated to the neuroscience of mind-body medicine, yoga, meditation, and Tai Chi. Her expertise and is affiliation with UCLA, an integrative and geriatric COVID clinic that has been set up in LA. And she is still going to talk about the global impact, mental health impact of COVID, both right now and in the long run. What are some things that we are going to see, what she is seeing right now in her COVID clinics, and what is the efficacy that she's finding between yoga, stress levels, mental health, and any other practices that she might be doing. Dr. Lavritsky, if you could please talk to us a little bit about that.
Thank you very much, and it's an honor to be here. My background is neuroscience of yoga and yogic meditation, Kirtan Kriya particularly. And I studied the effects of Kirtan Kriya and Kundalini yoga in dementia, stress dementia caregivers, but also in older adults with mild cognitive impairment. And what we found neuroscientifically was improvement in immune function, improvement in brain connectivity, and improvement in cognition, resilience, and mental health overall in caregivers. And that transferred also to aging adults. And now we're conducting a study in older women with cardiovascular risk factors and memory concerns, finding the same things, that yoga practice rewires the brain, rewires genetics. We are not victims of genetic predispositions to disease. We could rewire it through practicing pranayama, kirtan kriya, and kundalini yoga. But now I also established a COVID clinic where we're dealing with long haul COVID. And I'm transferring all of this knowledge that I gained by studying older adults into post-COVID clinic, where we are prescribing basically breathing practices. We study a breath practice, which is pranayama 4-4-6-2 breath with longer exhale. And we find that parasympathetic system that is engaged in stress response, that rebalances the brain and the body response to stress, is enhanced by this slower breath, 4 to 6 breathing per minute, breath minutes per minute, but also longer exhale would activate parasympathetic system and reduce sympathetic response to stress. Also, all of it improves immune function. We also recommend a yogic lifestyle that engages dietary choices with some knowledge gained from Ayurvedic practices, using, for instance, honey or ginger or garlic, and the immunomodulating properties of the mushrooms to improve immune functions. Such studies are being conducted using Ayurvedic principles for COVID and post-COVID. Speaking about global, I mean, the entire globe is engaged in this post-COVID response, and it's not just to the disease itself, but the burden and the lockdowns and the economic burden that a pandemic brought to everybody. And we're finding that population at large is becoming more amenable to practicing yoga, and also wants to know about what boosts resilience. I actually wrote a book about resilience in aging, where several years ago, that sort of looks forward to how neuroscience of yoga can enrich our practices and encourage resilient attitude towards stress. And so what yoga and mindfulness bring to us is our ability to self-regulate. When there's this immense stress, we train our body to not respond, to not react. And by distancing ourselves, by taking a breath, by centering and balancing, being in the moment, we can decide to be creators of our life rather than victims of the circumstances, and take steps to protect ourselves and our loved ones. in terms of post-COVID, what we see is about 30% of people who had COVID will continue having symptoms in coming months. And now we're over a year, and many are disabled by the symptoms. And the symptoms include fatigue, brain fog, cognitive impairment, malaise, anxiety, depression, PTSD, increased suicidality. And many are now even frontline workers like nurses and policemen are now disabled by the symptoms. So the world has to prepare for this avalanche of disability of long haul COVID or long COVID. And what I learned from my studies with yoga in older adults, I'm now transferring to help these victims of post-COVID syndrome. And it's a slow progress, but we see that by doing acceptance therapy, mindfulness practices, and yoga practices, especially breathing practices that are very important in acute COVID, but also in long haul COVID, it rebalances the body. The process is slow, it might take months, but it is helpful. Drinking calming teas, using essential oils like lavender can help calm the body, calm the central nervous system, and improve immune function with this process. So it's a challenge for the entire world, but I think we're prepared, and getting together and holding hands around the globe, helping each other. We're entering a new world of interconnectivity, human connectivity, neighbors helping neighbors. And no religion could achieve this kind of thing. Unfortunately, it required a virus so that the world learns the lesson that our connection is very important. And like this webinar, for instance, it's a nice opportunity to collaborate and learn from each other. And I thank you for this opportunity.
Thank you, Helen, Dr. Leveretsky. We will come back with more follow-up question. I want to introduce Soumya Srikumar, who is our fourth speaker joining us today. Soumya is actually on the ground in Bangalore. She is a psychiatric social worker in private practice with a specialty working with people with disabilities. And she's here today to report on what is the situation in India as they deal with COVID. She has been providing psychosocial and psychiatric first aid training for other community workers who are on the ground trying to get the numbers and reach out to the masses. So if I could please invite Soumya to please take the stage and set the stage for us, if you will, Soumya, and what is the situation that caused the psychological first aid training to emerge in India?
Thank you, Dr. Aparna. I'm basically a psychiatric social worker working with parents of children with special needs. I usually use positive psychotherapy and mindfulness practices today, but I will be talking about an entirely different training which we took about, which was a response to the increasing numbers in the first week of April and May. Psychological first aid may be defined as a compassionate and supportive presence designed to mitigate acute distress and to assess need for continued mental health care. The need for psychological first aid training was the Indian subcontinent saw a surge in the number of people after in the months of April and May 2021. By the first week of May, about 21 million people in India were affected by COVID and 200,000 people had died. The bereaved families were stunned, dazed, apathetic, and suffering from a disaster syndrome. So we can clearly see the COVID-related deaths had caused systemic disturbances in the micro, meso, and the macro levels, causing personalized stress and collective grief and trauma. So the Association for Psychiatric Social Workers came together in the view of the pandemic, and they decided that we have to build the people working in the community to respond to the needs. So thus came a series of trainings in the first week of May to impart special skills to deal with the pandemic and handle the emotional and the social trauma associated with the same. The psychological first aid training was done using the John Hopkins Bloomberg School of Health model, which is the rapid PFA, where R is the building rapport and reflective listening, A is assessment, prioritization, intervention, and disposition. So the process initially was training was done to the psychiatric social workers with the intention that they will from all over India representing different states. So they go back to their states and train people in the community and social work students to respond to the immediate needs of the pandemic. So the process in brief I will be explaining is rapport building, reflective listening to the people generally helps in building rapport and increases empathy and a relationship between the patient and the client and the aid worker. Reflective paraphrasing questions generally help you to understand the problems of the client, and paraphrasing also helps you, feelings and thoughts. Paraphrasing the feelings and thoughts generally help, understanding what are the needs of the client. So once we understand understand the client and his where he stands, then we come to the assessment of what are exactly his situation, what are his needs, what is the real problem on the ground, uh, uh, what are the cognitive reactions, what are the psychological reactions, what are the uh, physiological reactions to the stress. So we assess all these, and based on this assessment, the next stage is the prioritization, where the psychological triage is done to assess the needs. What is it that it immediately has to be attended? So here it can be the basic needs, it can be the need for medical care, it can be the need for mm, you know uh, any threat to suicidal ideations, any dysfunctions. So these are prioritized, and what needs to be attended first is taken into account. For example, in a case, there was a client whose daughter with disability had passed away the same day, where the mother needed immediate oxygen support and she had to be hospitalized. So the priority here, immediately the aid worker, though the death of the daughter was a very catastrophic event to the family, and all the social rituals around the particular death had to be carried out, but the immediate need in that particular situation was the hospitalization of the patient who already had a very significant numbers in the chest x-ray, and her oxygen saturation was reducing. So the quick psychological support to her with regards to the death of the daughter was done, and she was mobilization of admission was done. So the peak may here, even getting a bed in the hospital ICU and with oxygen facilities was a very a stressful thing. The family had with great difficulty, with one side a death, had to use all the resources to mobilize a bed for this person. That such was the condition, such is the condition. Now the condition is little better, beds are easily available, but that a cup last month it was really very bad. So then after assessment and prioritization of needs comes the intervention. So what is it that I am going to intervene here? What am I going to do for the patient? It is something to do with the basic needs which has to be attended. Is it something to do with it is psychological emotions, or uh, I have to look at getting him back to uh, restoring his functional capacity as early as possible. So this was mainly done with the help of the support system. In India, on the ground, responding to this crisis, the informal support systems were very, very, uh, quickly mobilized by the people, be it resident welfare associations, be it cultural groups, be it religious groups, be it regional language groups. So I would be from the state of Maharashtra, but I would be residing in Bangalore. But my language group from Maharashtra mobilizes resources for people in another state who have come from that particular state. So, or be it the informal groups by the IT companies, they made amazing resources, list of resources which could be available, at a click of a button could be available to lots of people. So the support systems was the main thing which helped into immediate response for the needs of the people. So after intervention, if the person's distress was reduced and he was able to get back to his original level of functioning within one or two follow-ups, it was it was fine. Otherwise these people were referred to the next level of care uh, through liaison or advocacy. So this was mainly the work which was carried out by the Association of Psychiatric Social Workers to build resources in the community. How many trainings have been done, or what has happened in the ground level? I do not have the exact numbers, as it is very very early in the uh, you know uh, after the training. But what is happening now, if we can say, is the situation is kind of a little relaxed. The numbers have come down and the need for hospital beds is much reduced, but still the death rates are happening in the vaccinated, and much less in the vaccinated people, more in the people who are not vaccinated. And going now people are in a state of shock. They actually do not want anybody intervening with their personal life, as they are grappling to come to terms with the loss which has happened with a family member, or the or other psychosocial losses which they have gone through because of the pandemic.
Thank you for that introduction, Samya. And if I could request all the panelists to please turn on the microphones and camera to join, there are several threads of conversations that's been introduced by each one of our expert speakers. We had Dr. Parker talk about on an individual level what happens in your brain neuroscientifically when you are meditating and its impact on mental health. Obviously, before you care for another, you got to take care of yourself. We had Dr. Manoj talk about the need for integrative medicine and the urgency for connections in order to build resilience. We had Dr. Helen Lavretsky talk a lot about various interventions that are in use right now: yoga, meditation, alternative care, that all seem to be productive, that have an efficacy that has been neuroscientifically backed. And we have Samya, Mrs. Sri Kumar, talking to us about what is the scene right now in India. What is happening there in terms of care of everybody else? So, as we navigate all of these various conversations, I want to go first to Dr. Manoj J. What more do you think we can do to support resilience and recovery from COVID, both in the United States and elsewhere?
Great question, Aparna. I think first and foremost, we need to put it into the medical model. Uh, I know that some may not like that idea, but basically what I mean by that is this. Just as you go to a doctor and then there is a prescription, the doctor does a history, physical, and then writes a prescription. What we need to be thinking about is putting the management of the post-COVID syndrome, especially the difficulties of the emotional stress and the need for resilience and connectedness and mindfulness, in a toolkit, a prescriptive type of model, which then can be taken up by research to do the study, but more so for the lay public to use, given to them by their doctor or other healthcare professional or a nurse. And even the general public can be doing it. So for example, think about this. There are exercise, physical wellness trainers, and then there are aerobic exercise models, and then there are other models to use for strengthening and muscle building. We need to do the same urgently for the mental well-being of our community, especially post-COVID. So a toolkit or a model that works.
Thank you, Dr. Jain. And I know Dr. Lavritsky and Samya Shivasri Kumar also alluded to this. What are some anticipated long-term outcomes or results, consequences, whether it's psychiatric, neurological, from COVID that you're seeing, both in India and again in the COVID clinic that you run? If I could go to Dr. Lavritsky first, what are some long-term changes that you're seeing, Dr. Lavritsky, that we need to address?
What the symptoms that are most difficult to deal with in the long run are this panic, anxiety, depression, and PTSD and brain fog. They're very difficult to treat. It's very disabling. Most patients are on disability right now. They cannot work. And many of them are very sensitive to medications. And so we have to find behavioral approaches, including meditation, acceptance therapy, breathing exercises, use of essential oils, acupuncture, acupressure, this integrative medicine approaches to find solution and help them in the long run. And we've shown that yoga meditation also improve cognition in older adults. And that's what we're using to help brain fog, cognitive impairment. And many of our patients are frontliners who got sick from taking care of patients, nurses and physicians. And so they cannot go back to the workforce. So this will be an impact for the workforce of healthcare practitioners.
And I see that thing, while I hear Manoj's urging to say, let's follow a medical model so that we have a protocol to dispense and distribute that we can follow. What needs to be in that toolkit are all of those interventions drawn from various traditions, whether it's yoga, meditation, you mentioned nutrition, Ayurveda, whatever the practices are that are scientific, evidence based practices should be in that toolkit to address this. Saumya, when you are in India, in addition to what Helen has talked about, are you seeing other needs emerging, or are you anticipating other needs? I'm thinking along the lines of children who are orphaned or women who are left behind without breadwinners. What are some other needs you're seeing in India?
We anticipate at least 10% of the COVID deaths would have prolonged grief reaction. That is usually the statistics, which out of the general population, 5 to 10% of the bereaved do have pathological grief reactions. And this is more so a traumatic situation. The death has happened in a traumatic situation. So probably there could be more people with prolonged grief reaction, difficulty in transitioning to the new roles of being the breadwinner, difficulty in getting opportunities also to transition. The current situation, the economic scenario is also here not very great. So even if I would want to cope, if I'm forced to also do cope, to go to a job, I may not get a job. So that is the kind of situation here. And how are the children who are orphaned? Are they yes, the support systems in India are fairly good. So the family, extended family members, the grandparents, or the aunts and uncles could take the children. But there are lots of children who have also come into the system, who are coming into the system, and who have come into the system and who have not come into the system. So if these children who have not come into the system, then there's going to be, the added risk of trafficking. So, the ramifications of the pandemic are here, going to be here for quite some time, and it is going to shake the people for at least a few years down the line.
And that's the concerning part. I recognize there is occupational interventions that need to be done, whether it's job training, relocations, there's familial social work training that needs to be done to help children who are orphaned, families who are left without a breadwinner, and then of course, our forte when it comes to mental health. So it sounds like, in addition to individual depression, anxiety, all of the anticipated reactions, there is also the concept of grief and trauma counseling. So, Stoma, Dr. Parker, if I might come to you, given what you've said about how yoga meditation intersects with the neuroscience, neuroscience corroborates what our yogis have said for a very long time about the need for yoga in order to both as a remedy and as a prevention for mental health. Where where do you see yoga intersecting with grief and trauma counseling that might be needed?
Well, this is interesting because first off, yoga shifts the relationship of a person with their own body and nervous system. And it's a scientific, meaning verifiable, experiential way to take hold of the neuroplasticity that exists in your nervous system and sort of take over the process of reorganizing your nervous system in a more resilient direction. That has always been the case. That part I think is extremely valuable. And I also want to just underline what everybody has said about the importance of human connections, because just we often, in trying to help somebody who is in emotional trouble, assume as we sit there and listen that we have to do something. And as my old mentor Swami Veda used to say, don't just do something, sit there, because to really listen with an open and mindful awareness is something that immediately opens compassion in both people, both the speaker and the listener. And that compassion is inherently healing. I mean, this we know for a long time from the traditions of psychoanalytic self-psychology. That compassion is healing per se. So just being able to sit and listen is so powerful in supporting people's resilience. And the more we can help to train people to do that without getting into a panic about the feeling like we have to fix things, it would be an enormous benefit, and I think we could train a vast number of people to do that.
And I see a fair amount of nods in our panel speakers. I'm also present at the time we have, and I know this is a conversation that needs to go forward. I am reminded of what Soumya and Mr. Srikumar had shared, that in India you have all sorts of grassroots organizations, well-intentioned, trying to help. And I'm sure that is probably true for many other countries too, whether it's religious, community, social, or even, as one of our attendees asked, rehabilitation departments. So given that we may want to follow a medical model and we are aware of certain reactions, psychiatric and neurological outcomes of long haul COVID that we want to address in our toolkit, we want to keep that. How do we get there? What are some specific things that we can do? How do we introduce this toolkit into a Western medical model? Manoj, if you might guide us, what is our next step?
I think there are a couple of parts to that. First, the toolkit has to be developed by a group of professionals. And there should be general consensus. Not everyone has to absolutely agree, but we develop a toolkit by getting together 10, 15 people, almost like a paper that provides a set of guidance in a very uncertain times. Then we need to let the researchers begin to do the ongoing research. So There's a clinical trial that uses elements of that toolkit. But that doesn't stop us from then taking that toolkit and making it readily available to the general public. And that's where I believe personalities, people who believe in yoga, meditation, mindfulness, the people who may be movie stars, icons, who will then take this idea and then move ahead, saying that we have general agreement that these practices which are within that toolkit will help us deal with the post-COVID syndromes and processes. And thus we sort of move ahead. Let science progress at its level, see what evidence it can produce based on those practices, and then let the idea flourish within the mainstream community through icons and others that can help people benefit from these practices.
And I think this is an exciting space and place to be at in a 1 hour webinar to say that, yes, we understand that neuroscience of yoga meditation has been well researched, has been established for what does pranayama do to your parasympathetic nervous system. Yes, that research is very easily available when you look. We also realize that there is a correlation, correspondence between general wellness and mental wellness. If your body is not feeling good, very likely you're mentally not feeling very well. But what we're talking about here is not that sort of unwellness, also. It's an outcome of what the trauma that people have gone through, both by suffering COVID and by surviving COVID and not having family members who probably survived. So I'm hearing that there is a possibility for a medical model that includes integrative care that we can put out into the market, whether it's a rehabilitation departments, whether it is already grassroots community organizations doing it. We give them a set of skills that they can use. So they, while well intentioned, they're not harmful. We are empowering them with these evidence-based practices. So, and I see questions here, and I've tried my best to also ask those questions. And for those of you who are watching, who want to be a part of this movement, whether you are a yoga practitioner, whether you are a meditation leader, a mental health provider, a volunteer, a community worker, and you want to be a part of this, write to us. Join us at the end. We will be sure to be able to include you in this as we move forward. So before we go into the wrap up and kind of talk about guided relaxation, which I'd like us to use simply because today is International Day of Yoga, I want to give all the speakers an opportunity for anything that they may not have said as a form of wrap up. Let me start with Samia Srikumar. Is there anything that you feel is pertinent that has not been said?
Another pertinent thing is these. There are so many informal support groups. Correct. There is a lot of burnout in these informal support groups, and these people have not been formally trained in mental health. They have just risen to the opportunity of serving their brotherhood, or people in the community. So I feel that a model of yoga and mindfulness, which can be used in training these people, will be very effective in generally maintaining the mental health of people, and sustain them to serve. We do not know how many more phases we are going to get of this pandemic. Hopefully not, but we also have to be open to the fact that it is going to strike us again, because of the generally of the vast population which we have, and the difficulty in vaccinating everybody. That is one of the main concerns in India. So we have to always keep these networks going. So it is we have to train these people, and we have to make them sustain.
Thank you, Samia. Thank you for those comments. Helen, if I might come to you, what are some wrap up thoughts, closing thoughts that you have?
So, pandemic brought forward innovation, technological innovation, new platforms of delivery of care like Zoom and online virtual spaces, phone companies, new apps, and that popularizes, it actually improves access to care. If that could be integrated into mental health care delivery, that would really help. We transferred yoga and Tai Chi practices online, and that increased participation, not decreased that. So there's something to look at how mental health services are delivered.
Thank you, Dr. Levitsky. Stoma, Dr. Parker?
I think that those electronic innovations have really been very, very valuable. In my own case, it greatly increased participation in our programs. I want to find a different way for medicine to relate to these traditional practices. Medicine has a bad habit of taking over cultural resources and appropriating them in ways that the original sources get lost in the process. And we have noticed, for example, in looking at the difference between secularized teaching of mindfulness and the traditional systems of mindfulness, that there's a certain depth of practice and a depth of experience in mindfulness that gets lost when that happens. So I want to find a way for those things to collaborate in a way that it does not become a hierarchical system. My own research work has been to try, for example, to get neuroscientific investigators to accept properly trained yogis as absolutely co-equal participants in the process of designing the methodology, for example, because there are things that they know from their self-observation that can never be measured by an instrument. So I'm very interested in this relationship between the resources of various traditional cultures and medicine. And I think this process of relating back and forth is gradually going to change both sides of that conversation.
Thank you, Soma. And the final word, wrap up with Manoj Jay.
Sure. As to Dr. Parker's point, I agree. We do not want to dilute the ancient practices. We really want to be talking about distilling them for the core elements that will be incredibly important for us as a secular society to be able to use them. And in terms of one final thought that I have in regards to where we can go, just think we have spent hundreds of billions of dollars on vaccines and make tremendous progress. The Biden administration put together $3 billion for treatment. We need to be putting in incredible amounts of more effort and money towards the mind-body wellness that is going to be affecting us from COVID. And I believe our group can be sort of leading that effort of how those resources can be allocated and best used. So I think this is a great start to that conversation.
Thank you so much to all of our panelists, Dr. Parker, Dr. Jane, Dr. Lebritsky, Mrs. Kumar. I know this is a beginning of a conversation, but it sounds like we have a beginning of a long-term initiative that when India and other parts of the world have the luxury of having a mental health crisis, once they're done surviving, we will be better placed to help them if we are able to create this model that is based on evidence-based practices and neuroscientific research. So before I invite all of you to go into a guided meditation with Dr. Parker, I do want to also give you a voice to Vayu University, Vivekananda Yoga University, which has been our event partner. Vayu is the world's first yoga university outside of India, focusing on graduate yoga education and research. They are based in Los Angeles, California, and they have numerous master's program and potentially doctoral programs on yoga and modern scientific approaches to traditional and ancient practice of yoga. So it's been a wonderful, it almost feels like a teaser in terms of getting us started, getting the conversation going, and then, oh, by the way, it's an hour, so we're done. So I hope that this is just the first of many more interactions. I really thank you for making time for this. And if I could invite Dr. Parker Thoma, if you would please lead us in a short guided meditation for all of us.
Sure. Bring your mind back from all the space around you. Feel the space your body occupies inside your skin. Let your mind come back from all other time back from memory in the past, from anticipation for the future. Just feel the flow and the touch of the breath in your nostrils, here and now. No need to do, just watch. And notice how your breath immediately begins to settle, to become longer, smoother, deeper. And you may also notice your body beginning to release the tension in your muscles. So wherever you feel tightness or tension, feel into that part of your body gently, lovingly, until the muscles just let go. And you may even feel as if your whole body is breathing. As if a wave of relaxed awareness washes you with the exhaling breath, energizes you with the inhaling breath. As you sit beside that quiet stream, just listen for the sound of the breath moving with the mantra hum with the exhaling breath, so with the inhaling breath. And for the next 2 minutes, just listen, follow that sound. Notice from where in your mind the sound arises. If you become distracted, just come back to the breath. And very gently, let your mind turn outwards again. Your eyes gently open, keeping this awareness of your breath. Om Shanti, Shanti, Shanti. Feel free to use this 2-minute meditation many times during the day, because the effect of meditation is additive. If you sit for 2 minutes 10 times a day, you've done 20 minutes.
Namaste, Stilma, Manoj, Helen, and Samia, and to all of our attendees. Thank you for coming. We will send the recording of the event to everybody registered. We will also have a survey that is sent out with one of the questions, how do you want to be involved? So if you are a practitioner, if you are somebody who wants to be involved in this teamwork as we build the medical model based on evidence-based practices and neuroscientific research, we'll be happy to include you, train you, so we can have that first level of community workers out when the mental health crisis does hit. Not yet, once they're done surviving. So thank you so much. And thank you for coming. We'll be here for a few more minutes for anyone who does have any questions. And I know, Samya, you are on Indian time. It's probably very close to midnight now, probably over. So I'm okay if you stay, but if you do have to go, I understand. So any questions anybody has, please be free to voice over, and we can. I see that most of the speakers have been answering most of the questions. That's so helpful. Thank you so much. Did you all have questions of one another as we are waiting for others, panelists, amongst yourselves?
So I was going to